our Healthy India Alliance member, Strategic Institute for Public Health Education and Research, Sipher, Dr. Rakesh Gupta, and our esteemed panelists who are joining us today and will be leading this particular webinar on tackling the silent epidemic, addressing hypertension, diabetes, and CVDs in India's public health landscape. So we have started this webinar series in collaboration with the Healthy India Alliance and Echo India, where we are focusing on strategies for prevention, control, and management of non-communicable diseases. So today we will have a different format where we will start with a panel discussion, and I will, in brief, introduce all our panelists. Then we will have a presentation and a question and answer session, followed by some key recommendations. So I request all participants to keep putting in their questions whenever at point of the webinar they have in the chat box, and we will take them up once we are done with the technical sessions of the day. So today we will start with the panel discussion, where we will be focusing on the public health implications of hypertension, what are the complications related to CVDs, diabetes, and hypertension. And we also have Mr. Atul Gupta with us, who's a lived experience champion, who will be sharing his experience with us. So in brief, the panelists for today's session are Dr. Rakesh Gupta, who's the President and Director of Public Health at Sipher, former Director of Health Services and Director of Chemical Examiner Lab, Department of Home Affairs and Justice, Punjab. He has about 36 years of experience in the government setup and is a professional who everybody knows. I will also be looking at our next panelist, who is Professor Dr. Jeet Kashyap, DM of Cardiology and Professor and Head at the Government Medical College and Hospital. He has more than 45 publications, has done more than 5,000 cardiac interventions, and his areas of interest include intracoronary imaging and structural cardiac interventions. And we have our lived experience champion, Mr. Atul Gupta, who is a lawyer and has a master's by profession and has been awarded a national level award, Asia level award, and merit award across corporate sectors, and is an entrepreneur in Chandigarh. So I welcome all my panelists to this webinar as well. And I think to start with, we will be looking at, I will address one question each to the panelists and give them some time to respond. And we'll take the panel discussion forward accordingly. So I welcome you, Dr. Gupta. So my first question to you is that when we talk about public health interventions and what are the implications in hypertension, why do you think hypertension is often considered as a silent killer, and why is it a major public health concern?
So thank you, Mansi. Actually, we call hypertension as a silent killer because normally there are no noticeable symptoms until it causes very serious complications like heart attack, strokes, kidney failure, or the kidney disease or heart failure. So, and it is one of the major public health concerns due to the high prevalence of the hypertension, and there are increasing incidences in younger populations also. And a lot of cost is also involved in the long-term treatment and management of complications.
Sure. Dr. Gupta, thank you for highlighting why hypertension is an extremely important condition that we need to look at. My next question is to Dr. Jeet.
Please check if Dr. Jeetram has been able to join because he was having some network problems.
Sure. So I will, we will check that, sir. So Atulji, I will address my question to you. So according to you, what are your perspectives on meaningful engagement of people who are living with chronic conditions? I welcome you, sir.
Atulji, you are muted. You are muted.
Is it okay now?
Yeah, it's okay.
Yeah, good evening, Mansi. Can you please repeat your question, please?
Sure. So, sir, according to you, what are your perspectives on a meaningful engagement of people who are suffering from chronic conditions?
As far as my experience of last 3 decades, I'm a patient of diabetes, and recently I've been suffering with heart disease as well. So my suggestions to all people suffering with chronic diseases is, first thing, not to keep in their mind. I mean, any point of time, they should not take any stress in their mind. They are suffering with such a big disease, and parallelly, they should always take care and whatever the doctor had prescribed them, and they should do the needful in time.
So thank you, Atulji, for highlighting your suggestions for people who are living with chronic conditions. So till the time we wait for Dr. Jeet to enter the webinar discussion. So Dr. Gupta, my next question to you is, how effective, according to you, are lifestyle interventions such as diet and physical activity in prevention and management of hypertension?
So, Mansi, I think they are highly effective in both preventing and management of the hypertension. So, what we need is a diet rich in fruits, vegetable, whole grains, lean proteins. They have actually proven to lower the blood pressure. And we must reduce the sodium intake. So, maximum sodium intake should be 5 grams, not more than that. And we should also increase potassium consumption and maintain a very healthy weight. So regular physical activity is required at least 30 to 60 minutes most of the days in a week. And these interventions not only reduce the need for medication, but they also contribute to overall well-being and lower the risk of other chronic diseases and the complications related to hypertension.
Thank you, Dr. Gupta, for highlighting how important diet and physical activity are in hypertension. I welcome you, Dr. Kashyap, to this webinar. And we're extremely thankful that you've joined us today. So we have started with the panel discussion and have addressed a couple of questions to other panelists, Dr. Gupta and Atulji. So I will start with my first question to you, which is how can we ensure equitable access to essential medications and follow-up care for people who are at high risk?
Okay, thank you very much, Dr. Gupta and all team ECO HRIDAY for inviting me for this panel discussion. Sorry for being little late. There was some network issue going on. So, so if we talk about ensuring of the equitable access to healthcare, I think there are certain issues that needs to be taken care of. So one is the availability of healthcare at various levels. So we have to ensure that healthcare facilities are available in the remotest of the area for which obviously health policies will be needed to ensure that the remotest of the area or the rural areas, they are equipped with the primary health centers, sub-centers, so that people can access the healthcare. So that is one part of it, how we can make healthcare available to all persons. The second part of it is the availability, affordability. The health should be affordable to each of the people, whether they are living in rural areas, where they are poor, they are rich, it should be available to all people. So for affordability, I think it's the responsibility, there's some responsibility on the government that we frame some of the policies which will ensure that the healthcare is accessible to all people. For example, uh, the price controlling. The government has the authority, it has the power to control the prices of all essential drugs. Like it has done, the government has done for many drugs, and some of the drugs used for NCDs are like statins, aspirin. They come under price control. So government has already done it. And recently, we have seen few years back, 5, 6 years back, that government had kept the prices of the coronary stents. So in private hospitals, there used to be higher price. So government in 2006 the price to 40,000. So this is the example where government can act in ensuring that everyone can afford the essential medicine or essential surgeries or equipments. The other thing which government can do is to provide some subsidies. Okay, so government can provide subsidies on medicines, can provide free of healthcare to some of the people who belong to low socioeconomic status. So that government can do. Third thing is that there are certain schemes like there's a PM fund, there is a chief minister fund in every state. Then there are certain other funds like MP fund, MLA fund, DC fund, and local level funds are available. Access to these funds so that patient can have the access to healthcare. The fourth thing, which is important, is use of generic medicines. So if you have a high quality medicines, they can be used as an alternative, which are cheaper and have the same efficacy, provided that they are from the good houses. Okay, so that can be used so that it becomes accessible to poorest of the poor person. Other things which can be done to have a good access to the health is that government or certain NGOs can uh, do a contract with pharmaceutical companies to gain bulk purchase of the medicines, which can then cost at a lower price, and can many patients can benefit from these schemes. Then certain policies are there, like there's a CSR fund. So like pharmaceutical companies, they have to pay CSR 5% to silver. So that fund can be utilized for procuring medicine for these poor patients. Other things like certain online pharmacies and certain government uh, uh, sponsored pharmacies like Amrit Pharmacy or Jan Aushadhi, they provide medicines at cheaper rates. So these are some of the things which will ensure that healthcare, especially, is available to the poorest of the poor person and the remotest of the remote area. For a follow-up of these patients, ensuring the follow-up, what we can do that we can share at like at C or healthcare worker can ensure that the patients take medication, they come for the follow-up. And nowadays it's a era of artificial intelligence and telemedicine. So that can be used to send reminders to the people that their follow-up is due and they can come for the follow-up. So that's how you'll ensure that people are coming for the follow-up. So these are some of the things that we can do to ensure that healthcare is accessible to all people and we have a good follow-up of these patients.
Thank you so much, Dr. Kashyap, for enlightening us with all the measures that people can take who are suffering from non-communicable diseases. And especially with regards to equitable healthcare system is what we were wanting to get an idea of, which you have clearly highlighted and explained us comprehensively. So, Atulji, my next question is to you. And I want to understand that, especially for people who are, living with chronic conditions, there are a lot of myths and misconceptions around CVDs, hypertension, diabetes, and other non-communicable diseases. So, what kind of, do you think that health educational campaigns, awareness campaigns, are important, and are there any other techniques that you feel we should, invest in so that we can give the direct and correct knowledge to people who are suffering from conditions?
Yes, Mansi, very much. All these campaigns are very much required, not only in urban areas, but the rural areas too, as already my colleague had highlighted it. So they don't only campaigns, not only educate them, but also update them that how they can cure their diseases. And in India, urban people, they really get all medical aids, most probably most of the time. But it is the rural area where people are not in a position, either they don't get medical facility or they don't get the medical doctors over there. So yes, we need a focus. The government should really need a focus on this, that everybody, every person, every individual in the nation, they should be given, and this campaign should be always there, time and again, in each corner of the country.
Thank you.
It always helps. It always helps in updating the patients that what do's and don'ts, what they should avoid and what they should look forward for to cure themselves from these diseases.
Thank you, Atulji, for highlighting how important evidence-based awareness campaigns are, and how they can really negate myths and misconceptions that are present across social media and other channels. Dr. Gupta, I would want to understand that when we try and integrate hypertension screening into primary healthcare setups, what are the major challenges according to you, and what are some suggestions that we can work on so that we can screen, manage people at the primary healthcare level?
Yeah, Mansi, I may tell you that recently I did assessment for government facilities, the sub-centers, Aam Arogya Mandir sub-centers. So it was in UP, then it was in Jharkhand, and then today it was in Madhya Pradesh. So I was amazed to know about the knowledge of the community health officers. They are basically nurses, and they are very well versed in the treatment of the non-communicable diseases, especially. And they have plenty of medicines as per the essential drug list. They have all the medicines. For example, for blood pressure, they have atenolol, they have amlodipine, they have telmisartan, and diuretics also they have. So today I did not find atorvastatin, but otherwise most of the medicines there were available. So it is amazing. The knowledge of ASHA workers is also very good, and they help in the in the follow up also. So the challenges are definitely there in management and the primary healthcare setups. They include limited healthcare infrastructure. So I'm talking about very selective sub-centers. Not all sub-centers, they are well equipped. And there's inadequate training of the health workers, lack of awareness is there among the patients, and there's poor adherence to the treatment, and the financial barriers, they always remain especially in the rural areas. There is in some of the health centers managed by the government, there's shortage of affordable antihypertensive medications. In the government setup, it is normally free, but if it is not available, then it may not be affordable for always for everybody. About equitable access, I think Dr. Jeet spoke in length about it. Then we also need awareness campaigns and integrating digital health technologies for remote monitoring and follow-up care. And early detection and management is definitely required by screening of all the patients visiting government setups. At least 30 plus patients, they should all be screened for hypertension. So that is my say on this. So if you want to ask anything else about this.
Thank you, sir. So just want to, an additional question on this is that you talked about digital interventions. But when we talk about reaching the people who are in the rural areas, tribal areas, may not have access to technology, internet, there may be many other barriers. So, what are some of the suggestions on using digital interventions for prevention and management?
So Mansi, you will be surprised that all the three sub-centers I'm talking about, they had excellent internet connectivity. So some of them, they used their own hotspots. So I think if 1.5 GB or 2 GB is there available on their phones, so it is enough to connect their laptops also. They all have laptops. They all have, they are digitally uploading their data. So these are only selective sub-centers. I'm not talking about all sub-centers. But this is in UP, this is in Madhya Pradesh, this is in Jharkhand, and they are in the remotest possible areas. So they are actually well connected as far as the internet is concerned.
Thank you, sir, for highlighting this, that there is digital connectivity and we are progressing in terms of implementing digital tools for prevention and management. Dr. Jeet, I would want to take this conversation forward in the sense that Dr. Gupta also mentioned about task shifting. So according to you, when we talk about the NCD burden that India is facing, what is the role of non-physician workers, other frontline health workers that we have in screening, in management, and prevention of non-communicable diseases?
I think that is very, very important because the most of the patient, they do not visit a tertiary care center. Most of them will be visiting the primary care health center or the local clinics or sub center or whatever is available to in their vicinity. And obviously it will help us also in sharing our burden, because tertiary care hospitals are already overburdened with other things. Like if you talk about cardiology, we have a lot of interventions to do, so we really can't afford to screen or uh, 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 do the risk scoring for these patients. So these primary care health workers, like community health care workers, they have an important role in detecting as well as managing and follow up of these patients. Like community health workers, they can do a basic checkup for blood pressure, basic parameters like height and weight and BMI calculation, which will be helpful to detect the early stages of metabolic syndrome. If the patient is obese, if he finds impaired fasting glucose by sugar testing, or finds blood pressure in just borderline ranges. So early interventions can be done there and then, and we can prevent the further damage of the other systems. Similarly, like pharmacists and nurses, which are there in primary health center, can also help in scheduling medications, can help in patient education, can help in counseling of the patient, and also in detection of the various disorders, metabolic disorders. And there's a concept of nurse-led clinics. If you train the nurses in cardiovascular disease or metabolic disease or lifestyle-related disease, so we can save on something, and we can decrease the burden of doctors, right? And they are also helpful in providing mobile health teams. So there in peripheries, you might be seeing that there are some camps held. Sometimes the teams from the hospital visits the homes of the patients. So in that way, those people are very, very helpful in as a link between patient and a tertiary care hospital. So I think it will be worthwhile that if we explore uh, these people more to provide basic health care and make a link between tertiary care hospital and the patients.
Thank you, sir. I think your answer in terms of frontline health workers being a bridge between the community and the health system is something which is well taken, and we're also working on such models so that task shifting, can take place and be better managed and screen our communities and people who are suffering from conditions. So I think my last question, because we only have just a couple of minutes left for the panel discussion, then we move on to the technical session. So Atulji, according to you, if you know of someone, if there is a person who is recently diagnosed with hypertension or diabetes or any cardiovascular disease, then what are your core 2 to 3 suggestions that you would want to highlight?
You see, my suggestions is very clear. Once you are aware of any diseases, CVD or hypertension or diabetics or any chronic diseases, once you are aware of that, any person should take 3 precautions. That is, one, he should consult to a right doctor and take the proper medication, which should stand at a table 3. Sorry, first he should go for a required exercises. He should prevent himself by doing certain. I'm sorry, once again, the person should do exercises first. He should take a proper food second, and then he should go for some medicines so that he can cure his disease or reduce his diseases because of taking the precautions. I'm sorry, I'm not a doctor. I'm a patient, and I'm not aware of certain terminology of medical profession. But what I feel is that if you can really do better, good exercises, take proper food, so you will definitely reduce the effectiveness of the diseases on your body, and rest the role will play by the medicines given by the doctor. So these 3 things really, if anybody, either he was earlier detected or recently detected, if he does all this, so one can live a very healthy life, and he can also be an example for other people around him.
Thank you, Atulji, for sharing your experience and suggestions with us. So I would like to thank our panelists, Dr. Gupta, Dr. Kashyap, and Atulji, for clearly communicating key asks, suggestions for prevention and management of hypertension and other non-communicable diseases. So we will now move on to our next technical session, which will be taken up by Ms. Tamanna, who I would also like to introduce. So she is a Master's in Public Health and Nutrition and is interning at Sipher at the moment. She's experienced in community nutrition, has led initiatives during the National Nutrition Month, and has worked with several non-government organizations. So she's a strong communicator with leadership skills and is passionate about improving health outcomes through nutrition education and disease management strategies. So Tamanna will be talking about the role of diet in hypertension. So I welcome you, Tamanna, for your session.
Good evening, everyone. So I'm gonna share my screen.
Tamanna, we can hear slight echo from your end.
आवाज कम करना.
Just wait a minute. Just wait a minute.
Is it okay now? नहीं. Is it okay now?
Tamanna is in my room. She'll move to other room. Then then echo won't be there. So Mansi, please wait a minute.
Sure, sir.
राइट साइड पे नहीं, पीछे ना, पीछे.
So, good evening, everyone. I will be sharing my screen.
In the meantime, I may tell Mansi that you must utilize the services of Dr. Jeet. He's a very accomplished cardiologist in the area. So we can ask him about hypertension and the related complications. So later on, maybe after Tamanna. Yeah.
Sure, sir. We'll do that.
Tamanna,
Are you ready? Tamanna, if you need assistance, we can share your presentation from here.
or in the meantime, we can take some snapshots. So anyone from the team can take snapshots. So if all may open up their videos, we can take snapshots, good snapshots. So all may please open up their videos. कोई ले रहा है snapshots ले रहा है?
Yes, sir. We're taking the
Okay.
snaps.
Thank you. It is good to have snapshots for your report.
You've taken the pictures. I would like to thank everyone for switching on their videos. If you're ready.
So Mansi, it would be better if you share the अच्छा एक मिनट अनम्यूट के लिए उसको अलाउ कर दो. Can you allow to unmute herself?
So we're doing that.
So, is my screen visible?
Yeah.
You're not able to see the presentation.
Yeah, I'm going there. Is it visible?
Yeah.
Okay.
Yeah, so good evening, everyone. So I'm going to present on diet and hypertension. So talking generally what hypertension is, it is defined as elevated blood pressure in the arteries, and it is diagnosed
Tamanna,
when the
we're not
systolic
able-
blood pressure is greater than 140 mm per Hg, and the
Tamanna?
diastolic blood pressure is greater than 90 mmg per Hg. Yes, sir.
Tamanna, we're not able to see your screen.
But it was visible to me. I don't know why. Yeah, ऐसे करो आप कर दो उसके ना present.
Tamanna, let us share the screen and we can tell us to move your slides. Will that work?
Yeah, sure.
Okay. So yeah, it's up.
Yeah, it's okay now. Yeah. Handipoli.
So talking generally about what hypertension is first. So it is defined as elevated blood pressure in the arteries, and it is mainly diagnosed when the systolic blood pressure is greater than 140 mm per Hg and the diastolic blood pressure is greater than 90 mm per Hg. And on at least two different occasions it has to be detected. Then the person is considered as hypertensive. Next slide. So what is the impact is in India? So around 30.7% of Indian adults have hypertension, around which approximately 1 out of 4 individuals in India have hypertension. And men are slightly more prone to it, mainly due to hormonal, biological, and the lifestyle factors. And in urban areas, it is the prevalence is higher due to the urbanization and our shift towards processed foods compared to the rural areas. And as many of the population has unaware about their hypertension status, and even those who are aware, very small percentage of their blood pressure is adequately controlled. Next slide. So the risk factors. So diet is a modifiable risk factor and can be modified and should be modified because as we know that hypertensive can lead to other serious diseases such as heart and kidney disease. So diet should be managed. Next slide. So I'll be talking about the dietary factors that are influencing our blood pressure. So the main thing in hypertension is controlling our sodium intake, which increases the BP. So as we know that according to WHO, we should take less than 5 gram of salt daily, which is around 1 teaspoon of salt a person with hypertension should take daily. And also potassium has to be included, and this is only for people having blood pressure. If somebody is having kidney disease, they should consult a doctor because potassium has to be restricted then. And we can also see the sources for potassium, which are fruits, green leafy vegetables, dried fruits, and legumes. They should be added to our diet. And talking about fats, trans fats, which come from processed foods and increases our bad cholesterol, should be avoided because it worsens our blood pressure. And omega 3 has to be included as it lowers the bad cholesterol. And some sources for omega 3 can be chia seeds, flax seeds, soya bean, and spinach. These should be included in our diet. And fiber and plant based diet should be included as it reduces the BP. Fiber come from fruits and vegetables, so it should be taken. Next slide. So talking about DASH diet, it is known as dietary approaches to stop hypertension. So it is a diet that was introduced in United States. It was a part of an research, and I think so it can be easily adapted because it is very easy to adapt, and it does not even cost our pocket that much. So this is an easy changes that can be made. And this diet mainly focuses on reducing the salt content, increasing the fruits, vegetables, whole grains, and legumes in our diet, and also decreasing the unsaturated fats and decreasing the red meat, which is uh, high in fat content, and also decreases, and it also focuses on decreasing the sugars that we should take. So as we can see that we can eat vegetables, fruits, whole grains, fat-free and low-fat dairy, poultry, beans, nuts and seeds, vegetable oil, and we have to limit fatty meats, full-fat dairy, sugar, sweetened beverages, sweets, and sodium intake. Next slide. So we'll see into the benefits of this diet. As we can see that this diet provides us with a huge amount of micronutrients, which is potassium, magnesium, and calcium, along with fiber and antioxidants. And all these things helps in maintaining our blood pressure, and it also regulates our heart health. So this diet is very beneficial for us and should be followed if you have to see results. Next slide. So as we can see that DASH diet is already low in salt, but we can also reduce salt by further actions such as reading food labels. Before buying something, it is very essential to read what we are putting in our bodies and should be knowledge. We should have knowledge about it. And also we should use salt-free spices. We can use herbs, and also we can use lemon juice for flavoring instead of salt. We should not add salt when cooking rice, pasta, as we can see, as we see in our Indian homes, that it is very normal to put salt when we are cooking rice or pasta. We should avoid that, and also eat less of restaurant food. And if you're eating at restaurants, you can ask them to put less salt or to have no salt at all in your order. Next slide. So here are a few tips. The number one tip is look at food labels, and we should always also look the content of the sodium. It should be less than 140 mg, and we should avoid saturated fats, which can include the egg yolk, the whole milk, cream, ice cream, butter, and fatty meats. We should avoid that. We should choose lean protein foods and should opt for fat-free dairy. And we should also look for words such as hydrogenated and partially hydrogenated on food labels, because they are very high in saturated fat and trans fat. So if a package has written these words, so they should be avoided. And we should also limit fried and processed foods, and also bakery products should be avoided. And we should pay attention how our food is prepared. So rather than deep frying or using a lot of oil, we can choose grilling, baking. And we should also avoid high fat dressings such as mayonnaise, which is very normal to use. Next. So it is not even about diet, it is about the lifestyle we have to change. So lifestyle includes diet, weight, physical activity, and stress management. So all these should be managed, because it has proven, research has shown that they have shown a huge results, all of these. So physical activity for 30 to 60 minutes every day is required. We should avoid alcohol, and doing yoga, meditation, and mindfulness have reduced the stress and improved the BP, blood pressure. So these all should be managed. Next. Thank you. So this is all from my side. Thank you.
Thank you, Tamanna, for highlighting the role of diet and physical activity as well as overall lifestyle management in hypertensive disorders. So I will open the forum for some questions and request participants to put their questions in the chat box. Till this time, we have two questions that I would want to highlight, and I request the panelists to share their views on it. So the first question is that there are, we are aware of, as researchers, we are aware of what needs to be done by most of the sectors. So the idea is, and the question is about how to implement the strategies that we have talked about today in the primary healthcare setup, and what are the kind of gaps and issues and how should we address them? So Dr. Kashyap, Dr. Gupta, if you would like
I
answer.
think we should listen to Dr. Jeetram question because he has got good experience as a heart specialist, as a cardiologist. So, Dr. Jeetram, are you available? So I can answer to the question that the screening of the hypertension, I think that is important, especially by the ASHA workers and the community health officers, the medical officers working in the PSS. So it is important to have the screening of the hypertension patients. And then as Tamanna, I think Tamanna has summarized all the things that needs to be done. I mean, good diet, exercise, meditation, and how the diet helps in reducing the blood pressure, and how and awareness about the hypertension and the cardiovascular diseases or other complications related to hypertension that has to be made. So I think this is all from my side.
You,
So
Dr.
I think
Kashyap.
Atulji, if you want to add something to it.
I think at community level, patient education is very important. So
Yeah.
I think the healthcare workers, the pharmacists and the nurses in the healthcare center have a big role in educating the patient about lifestyle changes
Yeah.
and the dietary precautions that they should do. Tamanna has already told what all precautions should be done. So mostly the salt is one factor which should be restricted,
Yeah.
and they need to be told that you should avoid all those things which contain high salt, because in diet in your daily dishes you'll have some salt. And what you should avoid is pickle, the bakery products which are most commonly namkeen, biscuits. इसमें बहुत सारा salt होता है, अचार में बहुत सारा salt होता है, so they should avoid these things. So patient education is very important as far as implementing the policies. And obviously government has some role in getting the policies implemented, fix the responsibilities of all at various levels, at PSC level, at tertiary care hospital level, at zonal hospital level. So everyone has a responsibility, and government should also encourage the conduction of various health awareness program for general population. If you don't make the general population aware of the preventive things, then obviously the disease can't be prevented. So I think that is very important, how we will be able to implement these policies in the general public.
So Mansi, there are some questions in the chat box, so you
Yes,
can
so
ask
I
from
am
Dr. Jeet. Yeah.
I'm referring to those only, sir. So thank you for your inputs on the first question. So there is another question on people who are suffering from non-communicable diseases have several burden on them in terms of out-of-pocket expenditure, treatment burden, regular consultations, even going to different hospitals for different consultations for that matter. So, what is your experience, and how can we really look at reducing some burden from these patients?
Yes, Dr. Jeetam, you may answer, please.
So I think as rightly mentioned, that these patients who have NCDs will be having another complications also. Like diabetic patient, they will have some nephropathy, they will have some retinopathy also, they will have some neuropathy. So it multiplies, the complication multiplies, and cost of living goes up, cost of treatment goes up. So most important, as all of us have told, is the prevention is the best cure. So to prevent disease at the onset is very, very important. There is where comes the role of each and every healthcare personnel, especially the healthcare personnel at community level. So prevention is most important. And then once you diagnose a disease, treating it optimally, and again observing all the lifestyle and exercise related things will lower the cost of this thing. How you can otherwise lower the cost of treatment is by various schemes. Like government has launched various schemes, like Ayushman Bharat is a very good scheme, where the out of the pocket expenses have tremendously decreased. We have seen in cardiology that patient get everything free. It's 60,000, 1 lakh, 2 lakh rupees, any procedure, they get it free of cost. So that is one way that government can launch certain schemes. So already there are certain schemes by states or center. Ayushman Bharat is one scheme which is run by the center, and there are various state scheme, like we have in Himachal, we have Himcare. Then there are certain scheme which are there in Haryana, Rajasthan, their own state scheme. And capping of the pricing, as I told you earlier, some of the essential medicine prices can be capped by the government. I have already given the example that there are many drugs which can come under this list, and there are many procedures like stents I mentioned, orthopedic implant. They are trying to reduce the cost of this thing. So government has responsibility in fixing the prices of essential medicine so that it becomes available and affordable.
Thank you, sir. So there are a couple of questions on using the Eat Right initiative. How do we use the toolkit to provide dietary counseling? So if any of the panelists would like to talk about the impact of Eat Right toolkit and should we be using that for hypertension counseling?
So I think Eat Right is part of the this Ayushman Arogya Mandir SCs, especially. So they have special sessions regarding Eat Right thing. So they tell about the good diet to be taken, and Tamanna has already highlighted what the good diet is. So I think government of India is already taking care of this issue.
Thank you, sir. So I think we've covered mostly all the questions that were in the chat.
Mansi,
Uh,
you can ask about the hyperthyroidism.
Okay, so there is one question also on does hyperthyroidism cause hypertension? And if yes, then how do we manage it?
Yes, Dr. Jitra.
Oh yes, I think hypothyroidism one hypo and hyper both can cause hypertension by one or the other mechanism. So most important is that we control the thyroid functions, give appropriate doses of L-thyroxine, and mostly these patients of hypothyroidism they have disturbed lipids. So we need to check their lipids, and we should treat their lipids with the statin therapy. Most of them will have hypercholesterolemia. So if you treat the hypercholesterolemia, they are obese also, they gain the weight, and we have to manage their weight also and treat hypothyroidism properly. So that's how you are going to decrease the incidence of hypertension in these patients.
Sir, there is another question on when should we start medication for hypertension? What is the level and how do we really diagnose hypertension?
So I think Tamanna has already told that the BP now in fact actually the guidelines have come that even a BP of 130 by 80 qualifies for hypertension. So in the patient who have a borderline blood pressure, so initial thing will be the lifestyle changes and dietary modification. That is the first part. So patient should try lowering their salt intake, increase their fruits, fibers, and vegetables in their diet, and reduce the trans fats and reduce sugar. Sugar is very important as far as the weight is concerned. If you reduce the sugar content in your diet, your weight is going to get reduced very fast. And then you should observe these patients for 1 to 3 months on dietary restrictions, dash diet, what Tamanna has already told you. And if your BP is not on the target, so target is that your BP should be less than 130 by 80 millimeter of mercury. That is the target for all patients, and especially in diabetic and CKD patient, chronic kidney disease patient, target should be even lower. So even if your BP is not on the target, you have not achieved the target, then obviously we'll have to start the drugs. So drugs will depend upon what is the class of blood pressure. So if it is the class 1 that is more than 140/90, then you can start with a single drug. But if it is higher, class 2, stage 2 hypertension, then sometimes you might start with a combination of the drugs. So first in nutshell, you first try dietary and exercise. If not controlled, then you may have to add the various antihypertensive drugs.
Thank you, sir, for answering all of the questions, and it has been an interactive participant interaction as well, because they've really put in a lot of questions and obviously very good comments also in terms of looking at lifestyle, reading labels, etc., that have also come in as comments from our participants. So I would like to now invite Dr. Gupta to share some key recommendations, and then we will look at closing this particular webinar.
Dr. Mansi, can you please share the recommendations? We actually penned some recommendations.
Sure, sir.
Can you share?
We're on it, so just give us a minute.
Yeah, okay. Shishir has those recommendations. Yeah. So these are some of the recommendations. So for patient-centered approaches to comprehensive cardiovascular disease. So if you have any other recommendations, then you can just point out. Shishir, can you please read them out?
Yes, sir.
Okay.
So we have divided into different headings. So first of all, recommendations for patient-centered approaches to comprehensive cardiovascular disease prevention. So first one was, it is recommended to incorporate team-based care to improve the quality and maintenance of cardiovascular prevention. Decisions about primary prevention should be collaborative between the clinician and the patient. A clinician should assess 5 domains of non-health related measures like housing instability, food insecurity, transportation difficulties, utility assistance need, and interpersonal safety before advising. To facilitate decisions about preventive interventions, it is recommended to screen for traditional cardiovascular risk factors and apply the base and sex-specific evidence-based knowledges. After the age of 20 years, it is reasonable to measure traditional risk factors, at least every 4 to 6 years.
Shishir, I think we can share these recommendations with all the panelists so that they can give us suggestions, and we can just reframe these recommendations so that they're doable. We'll send these recommendations to the Ministry of Health and Family Welfare, and only those which are doable. Recommendations about nutrition and diet have already been given by Tamanna. A recommendation for exercise, physical activity, so they are already defined. What else? Adult or physical activity, diet, yeah. I think we can take from all the panelists. We'll share with the panelists so that they can give us their own recommendations in addition to these. We'll reframe them and then send to MOH Abdul. So Dr. Mansi, I think we can have concluding remarks from Dr. Jeet.
So Dr. Kashyap, if you would like to share one key message that our participants can take home.
I think the only key message to prevent cardiovascular disease or lifestyle disease is to prevent them. Okay. And diet and exercise are the two things which they should focus on. Okay. So take a healthy DASH diet, which Tamanna has already highlighted, which is low in salt, low in sugar, and high in vegetables, fruits, and fibers. That is one thing. And another thing is that be active. You have to reduce your sitting time or sleeping time or lying down time. So any activity, whether you walk around, whether you cycle, whether you swim, or whether you just sit at 30 to 40 daily exercise. Exercise intensity exercise means that you should get some breathlessness and some sweating. That is that you have done a good exercise. So these are two key messages that focus on your improvement in diet and exercise. That way you can prevent the cardiovascular diseases or any lifestyle related disease.
Thank you, Dr. Kashyap. Dr. Gupta, any last final thoughts from your end?
So I think Dr. Jeetram has already told you the importance of prevention of the disease, because when it is done, the complications they set in if it is not controlled, the hypertension is not controlled. So best thing to do is, I think, the screening of all 30 plus patients or persons in India. So that way is the best thing to do. Yeah.
Thank you, Dr. Gupta. So I would like to thank all the panelists and Dr. Gupta, of course, for leading this particular webinar. So we will have our next monthly webinar in March, and we will share the data with everyone. And I again thank all participants for their interactive discussions and our panelists for comprehensively answering all related queries. So thank you very much. And all the resources will be uploaded on the ECHO platform. And we will also be providing the post-test link, and the certificates will also be available on the platform. Thank you very much, everyone.
Thank you. Thank you, Team HRIDAY. Thank you. And thank you, Dr. Jeetram. And thank you, Atulji. It was very nice interacting with you all. And I think Tamanna has taken the cake. Actually, her presentation was really good. Yeah, thank you. Thanks a lot.